Welcome to this Fishbowl discussion on livestock data for action on the ground, the missing pillar. And my name is Ugo Pica-Ciamarra. I'm a livestock economy working in the animal production and health division of the Food and Agriculture Organization, FAO in Rome. And I have two co-hosts with me, Amira AbdelNabi, who is an animal health expert working at FAO Egypt in Cairo, and Stephen Gikonyo, who is a value chain expert at the FAO office in Nairobi, in Kenya. And we have structured our Fishbowl in two parts. First, I will give a brief introduction to the topic, and then I will ask Amira and Steve to share their experience with gathering data for implementing policies on the ground in Egypt and Kenya, respectively. And after the interventions of Amira and Steve, there are two ways you can join in. Either you can post your questions in the chat, or, and this would be my preference, you can get 2 minutes and join the conversation through the hot seat. And of course, you can enter the hot seat more than one time. So Steve, Amira, and I work for a project which is called Africa Sustainable Livestock 2050 project. And one of the objectives of the project is really to cooperate with national governments to design and implement livestock sector policies, and particularly animal health policies. And as we all know, we need good data and information to design and implement policies. And in particular, decision makers need two types of data and information to design and implement policies. First, they need data to identify problems and opportunities on the ground. And this data typically come from the livestock census, farm surveys, household surveys, other surveys such as the demographic and health surveys. And this data really portray the situation on the ground. They tell us, for example, whether livestock are productive or not, whether farmers vaccinate the animals or not, whether they sell their milk, meat to the markets or not. This data, however, only provide broad guidance on what we should do to address any problem on the ground. Think at any simple regression that wants to explain livestock productivity. And the regression may tell us, that education level, access to veterinary services, land size, all these factors influence livestock productivity. But this information on its own is not really sufficient to design any intervention on the ground, any policy or an investment. We need other types of data if we want really to assist countries to design and implement effective policies. And first, we believe that we need data on the capacity of the government to provide public services and goods. And this information is of critical importance, since one cannot really make any plan, design any investment without knowing, the capacities of the policy implementer. And the government, of course, is the first policy implemented. And what is surprising, what we have found surprising is that basically there's not any readily available information on basic capacity of the government to deliver. We don't know the budget allocated to animal health. We don't know how many animal health officers are operating on the ground. And we believe that this is one of the reasons many of the action plans that are designed, of the policies that are designed, are not well implemented, because they are inconsistent. They don't really take into consideration the government's capacity to deliver. The other key information that we really need is information on the business models of livestock farmers. We need to know how a typical working day of a farmer looks like, from where he purchases his inputs and at what cost, to whom he sells his outputs and at what prices. Basically, we need to be in a position to formulate the enterprise budget of a farmer to understand whether he's making a profit or not. And why is that? Because any policies, any investments aim to change people's behavior, farmers' behaviors. And of course, those changes are easier if they are consistent with the incentives that farmers have to take some action. And yet, if you look at all the data that we have, household surveys, farm surveys, they're not sufficient to develop a basic enterprise budget for a livestock farm. But even now, these two pieces of information, can be gathered with appropriate survey questionnaire. And this is actually what we did in the countries, and Steve and Amira will share with you our experience. But even if we have this information, we are not yet in a position really to assist countries in designing effective interventions policies on the ground, because we cannot really gather data on what I call the delivery mechanism. Because if we want to change things on the ground, we're going to change also the way, we behave, the government behaves, and farmers behave. But and this information is not available because we're actually doing something new. Let me make an example. Suppose that all the data tell us that only 25% of the farmers that get access to veterinary services. And imagine that the government wants to improve coverage. It wants 75% of farmers to get access to veterinary services. Now, what the government should do? I mean, it could on paper recruit more animal health officers. It will give a pay rise to the existing animal health officers. It could provide them with transport allowance over motorcycle. It can give vouchers to farmers to purchase animal services on the market. It can institutionalize community-based animal health workers. So to address the same problem, the coverage of animal services, there are plenty of solutions, but we don't know which is the right solution, and we don't have data about the right solutions. So of course some solutions can rule out immediately because they are basically unimplementable because, for example, of lack of resources, but others are all potentially feasible, but we don't know whether they are successful on the ground or not. So what we believe is that we really need to pilot interventions on the ground to test the effectiveness of potential policy instruments. Going to the above example, you may decide, to pilot, the institutionalization of community-based animal health worker in an area, or the provision of vouchers to livestock farmers and others so that they can purchase animal health services. So to summarize, we really believe that most of the data that we gather are good only to portray the situation on the ground, to understand problems and opportunities, but they don't really provide detailed guidance on how to move forward. For that, we need to gather data on the government's capacity to deliver, on farmers' business models, and more importantly, we need to test or to pilot, to experiment with different policy instruments on the ground to find out which one really works, and if its adoption throughout the country. So, and in Egypt and Kenya, we try to fill out this information gap, and Amira and Steve will share with us their experience in the two countries respectively. So, Amira, perhaps you would like to start. I'll stop sharing my screen. Thank you.
Okay, good afternoon all. I will complete what Ugo have started by explaining our experience in Egypt. We started in Egypt by trying to implement this methodology of having more information to assist the government or the public sector to implement some of the laws or problems they have. So we started to have some information or data we gathered from the private sector. We had a poultry producer biosecurity practice. Some results come up which we use after that in a co-creation dialogue or policy dialogue between the sectors. So the first survey we did is for broiler producer biosecurity practice. 75% report unsafe disposal for daily mortality and 33% throw them in water canal. We had also done a business model survey and enterprise budget for poultry producer. This proved that they are profitable with a net margin ratio of 16.5%. 11% of the variable cost was for veterinary care, vaccine, and drugs, and only invest 0.01% on biosecurity practice. We have also an assess of implication of implementing good practice in the poultry farms, and we proved that implementing biosecurity measures could be profitable for the farm. For a small size sample, we had 0.% less mortality and 0.1% higher net profit. That's what the results we got from a very small sample size for doing this survey. From the public sector, we started by having like a policy review about the law, if all these practices are supported and regulated by a certain law or not. And the most important was the government capacity to implement the policies and to provide service. So we find a lot of gaps in the governments, like shortage for training for field staff. We have budget constraints in implementing issue, like only 27% receive transportation allowance, 75% of the people reported difficulty in implementing their tasks in the field. And we have a few number of field vet officer. One staff could supervise over 25 poultry farms and 4 villages, which include almost 3,000 bovine. So these are the main information that we trigger with it the start of the dialogue between the private and the public sector. And then they decide together to using this and following a series of workshops and meetings between private and public sector to identify what problem to target and what solutions can be applicable from both sides, like public and private, and jointly implemented at field level. They agree on one problem to start with as experiments for our pilot, which was the unsafe disposal of daily mortality from poultry farm. We have the laws that support or regulate this. And our goal of this implementation trial, first try to convince the farmers to implement the law at field level, and to ensure the safe disposal of dead bird, to reduce the public health risk and to protect the environment. And what solutions they suggested is to try to process these dead birds into compost. Compost is an old method that was implemented everywhere, but not by the same way we are implementing. We are doing it as we do in household. It's like daily mortality added to a pile and forming a pile of compost that could be for good disposal way. What we expect is that the poultry producer, if they are convinced, they will sustain the composting process as a regular way to safely dispose dead birds. And the most important is to strengthen the linkage between public and private sector, and convince them that the methodology of policy dialogue and the co-creation of solutions and what we did as determine the problem and the solution together is a good way to solve any problem in the field in law implementation or in non-compliance to good practice. So we had information about 75% of farms unsafely dispose the daily mortality. They throw the dead birds in waterway, drainage canals, along the road, dump area to stray dogs. Lot of unsafe way of disposing for this daily mortality. The law to control the safe disposal, of course, is weakly implemented. There is no capacity for the veterinary service to implement, and the farmers are not keen about this issue of public health. In general, they want to dispose and they don't want to invest any money in doing like a way for safe disposal. We start by gathering some information, selecting some farm for our trial, training for the veterinarians to implement the process of composting, and then training for the farmers to teach them how to do it. And we had like a regular way of information data sharing to provide at the end like an evidence document that proves the success or what we did in detail, so it can be scaled up and used afterward. The information we started with was the farm budget. We regularly collect the farm budget, the return of composting dead birds for rural producer. We had also extra information about the quality of compost from dead birds as safe fertilizer, the impact on public health and environment by analysis of the product, and be sure that the product is free from pathogen and safe use for agriculture land. Our preliminary results up to now, is that we have a total of 26 farms that was engaged in our trial. 50% of them succeed to produce like a pathogen-free compost after analysis and the testing the composition. It was a good quality fertilizers. The process is doable. With the discussion, we have regular meeting with the implementers and with other entities in the public and private sector. The process is doable. The costs are very minimal, and can be all this process can be scaled up to other farms easily. The compost produced, if it is done properly, it is safe, and it is a good organic fertilizer that can replace chemical fertilizers in agriculture land, giving better results. So this will be very good for the environment if we can scale up for a number of farms in Egypt and adopt this as a good way of producing fertilizers from the waste they were throwing it away and polluting the environment and the risk the public health. It could be like an addition to the country to have like a very good organic fertilizers, very good for the land and beneficial to the environment in general. And that's all from my side, and thank you.
Thanks very much, Amira, for this highlight on poultry composting in Egypt. And Steve, I'll give the floor to you for the Kenya experience.
Okay, so good afternoon, my colleagues and the participants. I'll take you through what we are doing in Kenya in trying to gather sufficient data that can be used to make decisions and support improvement of policy implementation. We basically know or knew that some livestock value chains are really not behaving very well. The information scanty and maybe not even very much documented or adequate to be able to scale it up for decision making. So under the Africa Sustainable Livestock Program, and as Ugo has detailed it, we gathered stakeholders and we tried to understand why there is high non-compliance of adoption or complying with the recommended biosecurity and even regulations along the livestock value chain. And from the discussions with the stakeholders, we singled out the poultry value chain and particularly the poultry slaughter node as one of the value chain node that has very high level of non-compliance with the recommended biosecurity practices and even the existing legislation, and particularly the Meat Control Act regulations, that despite them detailing where and how poultry should be slaughtered, we gathered some rudimentary data and information that pointed to the fact that almost more than 50% of the total poultry slaughtered in Kenya, that is about 28 million birds, are slaughtered in facilities that do not meet the basic biosecurity measures. In addition, that the operators working in those slaughter facilities, about a quarter of them do not even have any medical fitness certificate to show that they are devoid of transferable diseases from humans to livestock or from livestock to humans. And therefore, this just pointed out to the high level of non-compliance. But to make a decision, we felt like that information was still very limited. And therefore, we went further to find out, to understand better how to deal with this challenge. So we gathered data on the enterprise budgets of the broiler farmers. and we targeted 100 broiler farmers where we gathered, adequate data that gave us an understanding of, are they making money, and therefore can they be able to invest in biosecurity measures. And we found preliminary results that showed that those enterprises are somewhat profitable. And we quantified their profitability at 3 levels. Those farmers that were not adopting any biosecurity, or they were adopting very minimal biosecurity measures, their profitability stood at 16%. Those farmers that adopted some minimal biosecurity measures, their profitability dropped down by 3%. So they were making $13 if they invested $100. But we also found out that if they invested in some minimum biosecurity measures and they accessed a formal market that paid more, their profitability rose up to around 30%. And then we asked ourselves, so what about the public sector? What are they doing to be able to support these private actors so that they can be able to adopt the biosecurity measures and enhance their profitability and reduce public health threats? And what we found is that the capacity of the local veterinary services in the 2 pilot locations that we are piloting our intervention is that their capacity is so limited. And we computed the staff to household keeping livestock, and we found that the ratio is too huge. 1 frontline staff to 1,600 households that are keeping livestock. We also found out that they spend less than 10% of their recurrent budget to be able to run the operations of visiting the farms, making reports, holding meetings, with more than 94% of their recurrent budget just going to paying their salaries. So that limitations was documented. We also documented that there are very few staff in the field. In fact, the understaffing rate was more than 50%. So they are operating below 50% of what they would want to be able to efficiently serve the very many livestock household keeping in their counties. And then we also found very limited support even to make them mobile to go and visit the farms. And therefore, this limitation also pointed out to then what can we do to be able to support the compliance or implementation of the policies on the ground. And therefore, within this context, we are able to hold several stakeholder meetings, dialogues, to be able to come up with a solution. And this solution premised on this context, where the broiler farmers are making some little profit, the livestock, the veterinary service, is so limited, and therefore this helped us to come up with a co-created intervention that we asked ourselves, what can the private sector do to be able to change the way they are behaving as they are doing their business? And what can the public sector do to be able to support the private actors to be able to adopt and comply with the biosecurity measures? So this is the intervention that we are currently piloting. We are targeting 60 broiler farmers. And so far, we have carried out 43 farm audits based on a checklist of 25 biosecurity criteria that we formulated together. And the preliminary results that we have is that the compliance with the 25 set of biosecurity practices is ranging between 40 and 64%. So far, we are seeing a pointer to that they are not very much able to comply with the entire 100% of the proposed security measure. We have also trained the slaughterers so that they are able also to support the improvement of the biosecurity at the slabs that are at the farms. So one of the milestones that we can say so far, and we have this information, is that after facilitating dialogue between the broiler farmers that have some improved on their slab, we have facilitated supply order by one farmer who has attained 64% of the compliance level, and he has already delivered 1,500 broilers to a formal broiler meat retailer. So what we are looking for is to collect adequate data that can help us to understand the compliance levels, to see whether the compliance has any change in terms of morbidity and mortalities, to also document any profitability or returns to investment in the biosecurity, also see whether there is any improvement in accessing the formal market, and then also use this information to be able now to make the decision, which is at the moment a dilemma, because we don't have concrete data that can say whether this approach is very sustainable or scalable. But we hope that when we collect the remaining data in our pilot, we can be able to use that to make the decision for scaling up and also determining whether this approach is sustainable or not. And that's what I have from myself. And back to you, co-host Ugo.
Oh, thanks very much, Amira and Steve, for these two presentations about really gathering data and facilitating, the use of this evidence to come out with sustainable and scalable solutions on the ground. Please, okay, Steve will, of course, also share his slides. So I'll just open the floor, for questions. So anyone who would like to join the hot seat for 2 minutes and ask questions to Amira, Steve, or even myself about, these presentations and, let's say, the way we are trying to address this lack of data, we believe, to really take constructive decisions. Christian is joining the hot seat. Excellent.
Yes, hello. Thanks for nice presentations, and thanks, Ugo, for the good introduction. I'm always wondering about how you recruit people to go into a trial, and how you keep them going. So I would kind of be worried that kind of people who join any trial are very motivated to actually do something about it. They realize that there's a problem, or they are quite incentivized through something, that they actually join the trial and actually stay with them at the time. And I guess part of what I think is the motivation is to keep them informed about all the time about kind of results, and tell them feedback about kind of what you observed in your trial. But I don't know how this is done. So I would be very interested in both Stephen and Amira, kind of how do you how do you select your people to join the study, and how do you keep them happy to actually stay to the end of your trials?
So I can start.
Please, Amira.
We can start from our Egypt experience. First, it was a co-creation solution between the public and private. So people engaged for the public sector. It was easier because we had this big orientation, and we select the people who are eligible to visit the farms or to do the job on the field, and we have a TOT training for them on the process and whatever, and they are assigned from the public sector. What we incentivize them is by having give them transportation for their visit, regular visit in our trial or experience. Regarding the public sector, we had a big series of meetings. We are working in 4 districts in Egypt, so we have meeting in each district, having explaining the process to the farmers and in details with experts on both sides for composting and for how to implement and so on. And we give them a questionnaire to select if they are main information about the farm and if they are interested in participating or not. And from this, we had the first name of the people who are already from the private sector engaged with us. And then we have another meeting for training of them, and we started with them according to their date of start with the production cycle and so on. So this was our way of targeting both sector we don't give incentive to the farmers, except we assist them by the technical visit from the public veterinarians on weekly basis, and they are engaged from their side.
Okay. Yeah, so maybe just an addition is that the choice was purely voluntary for Kenya, and I think this is because there are constraints in the value chain, and the early adopters would want to fix this this constraint. So they see an incentive. That's probably what is keeping them along. But as a program, we have scheduled monthly consultative meetings where we give them feedback on their progress, and we offer a training through the local veterinary service department. But for the public team, this is purely what they are supposed to do. So when they see a collaboration between FAO and them, they are really willing to be able to do what they actually employ to do, and the partnership is really bearing quite some progress and fruit. Yeah.
Thank you, Amira. Steve, perhaps I can briefly touch upon what Christian said. Yes, Christian, you're perfectly right. There was a sort of self-selection bias, I would say, in the process, and that was also due to the fact that we were working with local governments who had their own priorities. So I would say that yes, we are working with the innovators, but what's good is that the interventions or the changes in their business models are resulting in higher profits. So we believe, that eventually, this intervention can trickle down and also others, seeing, the value of those business models can then start adopting those business practices and some changes. But you're perfectly right. I mean, it was not really a random sampling. Isaac, over to you, please.
Thank you so much. I joined a bit late. Are you able to get me?
Yes.
Oh, thank you. So I don't know if there was a chance to introduce ourselves. So I'm from Zambia. My name is Isaac Silwamba. I'm heading a lab and diagnostic facility for a cooperative in Zambia. So I got interested in this brain dead because I sit on a lot of data. This is diagnostic data, but also feedback from the farmers, because we work with a lot of farmers that visit the cooperative. So my question for this discussion is, does FAO also engage the private sector in trying to get some of this data, apart from working with the public sector, which are the governments? I say this, like I said, we have a resource of maybe more than 200,000 farmers for the cooperative I work for. And I've just been thinking, the feedback we get, the amount of farmers we interact with, there's so much data that we get from them, and this can probably be useful for making livestock decisions, even for policymakers. But I feel the private sector is obviously doesn't have a good platform where they can probably share some of their experiences to make sure that this data can be incorporated in some of the public sector decisions that are made. So I would like your comment on diagnostic data specifically that we look at in the labs, and also we can easily administer questionnaires to farmers as they come to do the routine interactions which we give them. So I would appreciate your comments on that. Thank you so much.
Amira, I would say you are in the best position to respond to this question.
Okay, for farms, I think diagnostic data is available, but not within our ASL program. It is within other program implemented by FAO through surveillance or whatever. We have projects for surveillance of avian influenza in poultry farms. We have a project for AMR, for surveillance of data on AMR. So these data are available, and farmers, the problem is that we implement this through the public sector, so they own the data mainly, not only FAO, and they need to have to release this information. It need permission from the public sector in the country. However, for the farmers, they are not, to say they are recipients, they are not so engaged in doing it. Even it is not easy to get samples from farms or having this. It is done on obligatory surveillance program or so on, not on regular basis. Farmers usually have their own. That's the case in Egypt to test in private clinics or private labs in the country for their own benefit. That's from my side. But data is there. How to get it is we need to know in details what exactly is wanted.
Thanks a lot, Amira. We have 1 minute and 30 seconds. Sandeep, do you want to join in and just ask a very quick question? And then, we can continue this conversation by email. Vanessa, I'm not sure how I can extend the brain data up to 10 minutes from my side. No, Sandeep is not rejoining. So Isaac, thanks very much for your question. I think we can also follow up, via email, because we are also having programs in Zambia, and we would like really to partner with the private sector. And we believe, as I said, that in many cases we don't partner sufficiently with the private sector. And as you said, you're working with 15,000 farmers, you said, and gathering regularly data from them.
More than 200,000 per annum.
More than 200,000, sorry. And I think,
yes,
that's the kind of partnership.
Yeah, it's a cooperative. So we do offer consultation services. We're a non-profit making organization. And obviously we give them input as well at cost. There's so much
we have 15 seconds, Isaac. Perfect. We can follow. If you send your email in the chat, that would be great. We can continue this conversation.